Okay, this is the Foley catheter comp. I do want to say that I have to use the open one because it cut my recording off, and so I didn't have a choice because I didn't have another closed one. So I would start with my 12 safety practices. First, I would verify any care or orders for my patient. Second, I would gather my equipment and supplies. Second, I would wash my hands before and after any patient care or handling any supplies. Then I would gather my equipment and supplies needed. Then I would verify or consult the manufacturer for my equipment. Then I'm going to knock on the patient's door. I'm going to then identify my patient using two methods, patient identifiers. Then I'm going to note the overall condition of my patient. Then I'm going to explain the procedure and provide privacy. Next, I'm going to raise the bed for good body mechanics. Then I'm going to don my PPE. Next, after the procedure is finished, I'm going to make sure that I perform hand hygiene. I'm going to lower the bed. I'm going to put the side rails in place according to the patient care plan, and I'm going to make sure that they have a call light within reach. And lastly, I'm going to document and record any of my findings, and I'm going to report to the charge nurse immediately any abnormal findings. So after that, I'm going to come into the patient's room, and I'm going to I'm going to close the curtains, which was in my safety steps. I'm going to close the curtains, provide for privacy, and then I'm going to provide privacy. I'm going to wash my hands. Then I'm going to raise my bed, and I'm going to gather my supplies. If needed, then I'm going to raise the bed, apply everything. If needed, I'm going to put down a waterproof pad, and then I'm going to position my patient. And for a female, you want them to be in a supine position with their knees raised and their thighs relaxed so that their joints can externally rotate at the joints. So after they're positioned, I'm going to apply gloves and wash my hands again, apply gloves, and I'm going to perform perineal care, making sure to wash with soap and water, and I'm going to dry thoroughly. After that, I'm going to remove my gloves, and I'm going to wash my hands again, and then I'm going to open the catheter kit at the foot of the bed, and I'm going to place it in between my patient's feet at the foot of the bed, in between their legs. I'm going to use the plastic covering as a trash container, and I'm going to put that at the foot of the bed. Next, I'm going to open my kit using sterile techniques. So I'm going to grab the outermost 1 inch perimeter, and I'm going to open away from me first. And while doing all this, I want to make sure that it's not folding back onto any sterile fields. Then I'm going to open the sides, making sure it doesn't open back up. And lastly, nearest me. After that, you want to take your sterile gloves, you're going to pinch them in the middle. You're going to take them to your bedside table and going to drop them on your bedside table. Next, you want to grab the outer edges and open it, unfold it, and then under the tabs. And you want to make sure that it's not folding back over. So I'm going to start with my non-dominant hand. I'm going to pinch the cuff as I slide my hand in so that I don't contaminate my gloves. And then for the second one, I'm going to keep my thumb out and put my fingers underneath the cuff so that I don't contaminate my sterile gloves. Just like that. And once they're on, you want to make sure that they stay above waist level. and that they don't touch anything contaminated. So if my gloves were underneath my waterproof drape, then I would carefully drape the waterproof drape, grabbing the outer 1 inch and making sure that it doesn't touch any contaminated field, but it's not. So I am going to now pick up the waterproof sterile drape, and I'm going to make sure that it doesn't touch any contaminated surfaces. And I'm going to put the shiny part down. I'm going to ask the patient to raise their hips as I carefully apply the drape, making sure that I don't contaminate my gloves or the drape. I am then going to remove the blue drape, making sure that I don't contaminate any field, put it in my trash. I don't have rooms. And then I am going to apply the fenestrated sterile drape. I'm going to grab the outer corners. I'm going to let it fall open, making sure that it doesn't touch any contaminated surfaces. And I'm going to make a cuff with this, and I'm going to drape it over the perineal area, like such, making sure not to contaminate my gloves or the drape. Next, I am going to prepare my supplies. So I'm going to remove the tray and place it closer. I'm going to put it closer to the patient, and then I am going to prep my items. So I'm going to remove the hydrogen peroxide. If my patient were allergic to iodine, I would use this in replacement. I'm going to exit the sterile field and make sure that I don't contaminate my sterile field. Then I am going to take the iodine, I'm going to tear it open, and I'm going to saturate my sterile cotton balls. And once I do that, I'm going to remove it from the sterile field, and I'm going to drop it in the trash. After, I'm going to open my lubrication, and I'm going to place that on the sterile field, and I'm going to remove that from my sterile field and dispose of it so that I don't contaminate anything. After that, I am going to make sure that my bag, the tubing, is closed, and I'm going to remove that out. And I'm going to use the coiling and unfold the coiling and make sure that it doesn't touch any of the contamination. I'm going to set it in the petroleum jelly into the lubrication, and I'm going to leave the sterile field and toss that in the trash. Next, I'm going to apply the syringe to the catheter, making sure that it is firmly attached. Next, I am going to use my non-dominant hand to fully expose the urethral meatus, and I'm going to use my dominant hand to clean with the iodine saturated cotton balls, and when doing so, I'm going to use one single swipe and make sure not to contaminate anything. And so I'm going to start from the clitoris and go straight down to the anus, and I'm first going to do the far labia fold, and then I'm going to exit my sterile field and drop that in the trash. Then I'm going to go from the clitoris to the anus on the near labia fold, and I'm going to exit my sterile field and dispose of that. And lastly, I'm going to go straight down the middle, directly over the meatus from the clitoris down to the anus. Then I'm going to exit my sterile field and make sure that I throw that away. And then after that, I'm going to throw away outside of my sterile field the tongs, and keeping my hand on the where my hand is now contaminated, so it will remain here for the rest of the procedure. So I'm going to grab my catheter tubing from the lubrication, and I'm going to coil loosely in my hand the catheter, and I'm going to ask my patient to bear down while I insert the catheter, and I'm going to go directly into the meatus, and I'm going to advance the catheter slowly, making sure not to apply any pressure or force, and I'm going to advance it 2 to 3 inches. And after I see urine flow, or after I have reached the 2 or 3 inches, then I will advance another 1 to 2 inches. Once I have done so, I will then let go of the labia, and I will then grab with my non-dominant hand and hold the Foley as I use my dominant hand to slowly inject the fluids into the Foley catheter. And as I do that, it will take around 7 to 10 milliliters of solution to fill a 5 milliliter balloon. So you want to make sure that you slightly pull back on the balloon to make sure that it is secured, and once it is, you want to give a little bit more slack so that it goes back into place and is not tense. So after that, I can remove that and take off the syringe, and I'll leave the sterile, well, I'll put the syringe on there. And once that is inserted, you can see the balloon in place. Then I will remove the draping. And I will dispose of everything where it is supposed to be disposed of, which is right here for now. And after the procedure is done, you'll provide perineal or catheter care if necessary, unscheduled and routinely, or as necessary. Once that's finished, I'm going to attach the bifurcation of the catheter to the bottom sheet of the bed. I'm going to make sure that the catheter bag is secured to the bed frame, not the bed rails. I'm going to make sure that there is no kinks or coils in the tubing, and any excess tubing I'm going to coil around and secure it to the bottom bed sheet loosely, and make sure that there's enough slack to where the patient isn't pulling on it or having any pressure. Once that is done, I'm going to lower the bed. I'm going to make sure that they're clean in a comfortable position. I'm going to apply the side rails according to the care plan. I'm going to make sure that they have their call light within reach. I'm going to then remove my gloves, and I'm going to perform hand hygiene. I'm going to document and record all of my findings. I'm going to report any abnormalities to the charge nurse immediately. Hold on, let me make sure that that's everything. I think that's it.